Starting.
Okay, I'm going to start. So good afternoon. Welcome to the Health and Government Operations Committee, Chairman Pendergrass. My name is Vice Chairman Jocelyn Pena-Melnick. This is the Public Health Subcommittee, staffed by the Council Erin Hopwood and my staffer Edith Perry. We appreciate you being with us this afternoon. We do have an agenda and we're going to get started first with Senate Bill 708. And Erin, if you would be so kind and tell us what the bill does. And those of you that have not been with us, we allow everyone that has an issue or concern or wants to be heard to come to the subcommittee. And we have the department that on this bill issue a letter of concern with amendments, and we have amendments to address their concerns. So Erin, why don't you get started and tell us what the bill does?
The bill establishes a compliance officer within the Maryland Office of the Inspector General for Health to ensure that units and employees of the Maryland Department of Health comply with best practices in healthcare, public health, and government administration, and laws, regulations, and MDH policies within, as introduced within 7 business days after receiving a complaint or allegation. The Inspector General, the compliance officer, or a designated assistant IG must respond to the individual who filed the complaint or allegation with a preliminary indication of whether the Maryland OIG for Health is able to investigate the complaint or allegation, and if not, the reason for not being able to do so, and the contact information for the Office of Legislative Audit's fraud line. There is an amendment that shows up in the reprint, which is on page 24, of a handwritten page 24. If you look after line 20, the amendment would change from 7 to 30 business days after receiving a complaint or allegation, the requirement that the Inspector General, the compliance officer, or a designated assistant Inspector General respond to the individual who filed the complaint. And then it also, instead of striking the requirement that if the Office of the Inspector General is unable to investigate the complaint or allegation, it would provide that they must provide the reason for not being able to investigate unless providing the reason would have a negative impact on or jeopardize an investigation being conducted by the Office of the Inspector General, a managed care organization, another unit of government, or law enforcement.
Heather.
Thank you, Chairman Pena-Melnick. Erin did send us those amendments earlier, and I cleared them with the OIG's office, and they address our concerns. So we really thank the committee for making those adjustments.
Thank you for working with us, to make it work for you. And you're always welcome, okay? We appreciate it. Are there any questions regarding the bill from the committee? Delegate Shaliga, and then Delegate Hill.
Thank you. Heather, are you on for the Department of Health Office of Inspector General?
Yes, my apologies. Yes, so OIG is still in the Department of Health until July 1 of this year, at which time they'll become their own separate entity.
And then at that point, will they be able to do more than they're doing?
Truthfully, I don't know. I think that they're able to do, I would have to look at the exact bill language of the bill that was passed last year that separates them. But so I don't know. I would have to look into that for you.
My question would be this. I made a request of the Department of Health's Office of Inspector General about COVID testing because 2 different constituents wrote me that they were billed $1,200 for a COVID test, which obviously looks like price gouging. And they did reply to me, so they are replying, but saying it doesn't fall under the purview of our office. So, how do we expand the purview of their office so that they could address something like that?
So I think because that was, and I don't know the specifics, but if it was a private insurance carrier, that would fall under the insurance administration, and that wouldn't fall within the purview of the Department of Health.
Okay, so they would just say, even though it's clearly a COVID test should fall under the Department of Health, they would say, well, we'll shuffle you off to, they actually just sent me some link to the Attorney General's website. So do you have something written that tells us what they actually do? I mean, can we get a copy of what kind of complaints they actually investigate?
I can request, yeah, I can ask them for that, sure.
Okay, thank you.
Okay. So just so because I handle something similar, Delegate Shalega, the Office of the Attorney General has an office that deals with these kind of complaints for price gouging and for any complaints dealing with similar complaints with overreaching. Also, the MIA on their website has a button where you file a complaint against a carrier as well. I just learned that because I had similar people reach my office as well. So Heather,
Yeah,
if you could send it to the whole committee, I really appreciate it. All right. And when did you say it's they take over, they're independent? What is the date?
July 1 of this year.
Okay, July 1st. Okay.
Yeah,
Thank you.
so Chair Peña-Melnick, this was to a hospital billing $1,200 in one case and a big box pharmacy store.
So
billing.
that's the Attorney General's office. They have a department that deals with those kinds of bills for hospitals.
What the Inspector General told me was there's some law covering your out of pocket, which wasn't my question. My question was, how much are they charging the government for these tests? Like we have this tent set up right out here.
Yeah.
Is the state of Maryland paying $1,200 for a COVID test? And that seems to me like something that the Inspector General could look at.
Yeah.
But if they're taking the position that they'd rather just pass the buck and not answer things, then we certainly don't want them to be doing that. Thank you.
Yeah. Well, thank you. And thank you both. I have Delegate Hill and then Delegate Chisholm.
Yeah, thank you, Madam Chair. And this is real quick. I think it's really for Aaron. Unfortunately, I don't have a packet to look at. I can't find one. So
She sent it by email. Did you not get the email?
I'm looking at my email. So I'm looking, but I don't see, I see all about links to today's meeting, but I don't see anything, but that's okay. I just want to, I understand that this amendment was to address some or the major concerns from MVH. And I just wanted to know, was this an amendment that our committee came up with? It changes the Senate bill. Was this something that was worked out with the Senate sponsor? I'm trying to find the background to this amendment that we're considering.
On the Senate bill, MDH submitted written testimony.
Yeah.
And you received that written testimony. This was part of their written testimony. What they had requested was to go from 7 to 30 days and then to strike completely the reason for providing the reason. And so the chairman and vice chairman and they talked with Senator Lamb too about this kind of compromise where
And he's okay with them.
Provide the reason unless it would interfere with
Right.
a current investigation by another unit.
And we're keeping it at 7 because I asked during the hearing, we're keeping it
No,
at
we're
7.
keeping it.
No,
It's going to
from
30.
7 to 30. I will resend the packet to you. And it's on handwritten 24.
Aaron,
And so my
what
question
email,
for
one second, Delegate Hill, 1 minute. Aaron, what email did you send the package to Delegate Hill? Let's make sure we have the address.
It's the same one you would have gotten any sort of notification.
I looked on both. I looked at my laptop and the
Okay.
other. I just don't see it. Thank you.
I'll try again right now.
So Madam Chair, if I can ask another question, this
Yeah.
is for Heather. Heather, I asked the question during the hearing and I'm really confused. Why does it take 30 days to say we've received this, we're the right place, we have the authority to address this, we can get back to you about whether we actually will? Why does it take 30 days to do that?
So I think the bill as written said that they had to make a determination about whether or not they would investigate. That was the interpretation of the OIG.
Yeah, so if that part, it can stay at 7 days from your standpoint, as long as they're not making a determination, if they're just saying, we think we're the right folks, or, I mean, determination also means, a determination can be that it's indeterminate, that at 7 days, I tell you, we don't know yet if we are the right people, but we did receive it. It could say, yes, we're the right office, or it could say, we don't have the authority. So I'm really, 30 days is a long time. I'm very concerned about that.
Sure. I think if the committee is looking for an acknowledgement that the complaint was received, I think certainly that's doable within 7 days. But to make a determination about, they would have to do a preliminary investigation to make the determination about whether they're the appropriate agency or not.
So my understanding is that the determination is primarily based on, is this in our bailiwick? If you're asking about, fraud and abuse, that's in our wheelhouse. If you're asking about compliance with federal stuff, that's not. If you're asking about, if you're asking about gouging, that goes with the Attorney General's office. It's not in our office. That it's really saying that it is or is not within our wheelhouse. And so that's not an investigation. That's looking at the complaint and saying, does this fit in our wheelhouse? And what am I missing here?
I'm apologies. I'm pulling up the actual language to
sorry.
see. So it says, whether they are, if the Office of the Inspector General is unable, a preliminary investigation, indication of whether the office is able to investigate the complaint or allegation.
Which is not whether they're going to, or whether there's a conflict. And so maybe that's the part that needs to be changed, of whether this is an appropriate complaint to come to their offite. Maybe that's
If I
what needs
may,
to be changed.
Delegate Hill, we're compromising on the 30 days. We have to get vote on these bills. We have to be
Right.
on the floor at 4:30. So I would ask for your patience as we move the bills along. If we
But
can
this is
find
where
some.
we talk, Madam Chair, respectfully.
I know, and we always do, Delegate Hill, and you know that. For the entire session, I let everyone talk, but we're not going to change it. The chairman of the committee agree on 30 days. She called Delegate Lamb. He agreed in order to give the department some room. So we're negotiating and working with the department. So I ask you respectfully, we can continue to talk, but it's not going to change because the chairman put it forward an amendment that I will present for a vote. And we compromise on this bill because the department clearly stated they had a concern that they couldn't get it done. So the sponsor of the bill, Senator Lamb, spoke to the chairman and he's okay with it. I mean, you
Thank
can
you, Madam
talk, but what
Chair.
I'm saying is that it's gonna stay the same.
I understand, Madam Chair. Then just for
Okay.
the record, I will say that from the discussion we just had, the department misinterpreted the bill. Thank you.
Okay. All right. Any other delegatism?
Thank you, Madam Chair. And I think one of the things, and I brought this up in the hearing we just did 30 minutes ago, we passed a very key piece of legislation, and I was very much in favor with Delegate Barron to move the Inspector General from the Maryland Department of Health over to the Inspector General for Health, which is an independent unit of the state. So the Maryland Department of Health is going to have nothing to do with this come July 1st, 2022, which is in 3 or 4 months. My biggest concern now is, unless one of us can look into a crystal ball, we have no idea how this is all going to then develop come July 1st, 2022. Will this new independent state agency be able to do everything we're trying to get it to do without having this SB 708 added to it?
So I would say, Delegate Chisholm, that this actually helps. As Delegate Shalega just clearly, stated, they don't have the capacity right now. In July, they're going to be an independent office. This actually helps in my, respectfully, because it's adding one pin, right? A person who will be, and it's not that expensive either. It's $78,000 that will be salary and tasked to do this work alone. And as we know from what happened before, the whistleblower, these are contracts that are millions and millions of dollars, and you need eyes on it. And as it is, the office doesn't have a lot of resources. This will give the office one body that will be tasked with taking on this issue. So I will say that it actually helps.
I think
it's
the problem
great
we
that
had, I think the problem before that we had, and Dr. K, I think what's her name, spoke directly to it. Everybody was afraid to come out because they were under this shadow of the Maryland Department of Health. What we did last year was right, and it's going to fight against what you're concerned with and what I was concerned with. I think that the new office hopefully will be able to operate without feeling like they have somebody overlooking them and eyes on them and can have retribution against them. This is why we passed that law last year. I'm not against this bill. I'm just wondering how it's all going to play out.
Yeah,
and if it's absolutely necessary.
And I appreciate what you're saying, because we just passed the bill, you're right. But I really think that this would give extra resources for this issue that is so important. And I think that if you don't do what you have, people are still going to be reluctant regardless where they go. And I think that this actually helps, because it gives them the extra resources. And I do appreciate what you're saying, because they start as of July 1st, they'll be independent. But I honestly feel that this is great to do it now because they'll start together in that office, right? Rather than come later. So I appreciate your thoughts. I really do.
Thank you, Madam Chair.
Delegate, my pleasure. Delegate Hill.
Thank you. I just wanted to comment, in addition to what you said for Delegate Chisholm, I think what this adds to that legislation we fought so hard to get through when Delegate Barron was here, is it gives a different authority. Because part of the problem, as I understand it, was the OIG, no matter what office it was under, whether it stayed under health or it's in the new place it's going to be, they didn't have the authority to say this is an issue of
You're right.
incompetence, malfeasance, and public safety. That's the key part to your question, as I understand it.
And you're correct. And it's a good refresher. That's the reason why we did it last year, because they felt that they could not, they had to do whatever the Secretary of Health told them to do. You're absolutely right. And we wanted them to be independent, and it gives it clarity. Anyone else? Does anyone else want to be heard on this bill? Okay. May I have a motion on the amendments, please?
Move the amendments.
May I have a second?
Second.
Okay, it's been moved in second. Thank you. Any discussion or concerns with the amendments? On the bill as amended, may I have a motion, please?
Move forward. Move favorable.
It's been
We're not
moved in
voting on the
second.
amendments? We're not voting on the amendments?
We just did. I moved the bill. Delegate
Second.
Heather and Delegate Kaiser moved the amendments.
Right? You
And
asked for
then-
discussion.
And I asked for discussion and there was none. And then we moved on to the bill as amended.
Okay, well, I would like to be against the amendment, so just register. You don't need my vote, but I'd like to be registered as against the amendment. Thank you.
Sounds good. On the bill as amended, is there any questions or
bill.
concern?
Second.
Okay, it's been moved in second. Any concerns on the bill as amended? Seeing none, all those in favor say aye. Any opposed? There's no opposition, it's unanimous. Delegate Hill, did you receive the email sent by Aaron again? We can't hear you.
I'll check. I wasn't looking. I was talking.
All right, if you could
I
do
see
that,
it,
I will
yes.
be, you
Yes,
see
I
it?
have it. Yes,
All
ma'am.
right, so then, since you got it, we're going to move on, Delegate Hill, to House Bill 1403, Senate Bill 636. Give you a second so you guys can pull it up. And while you pull it up, Aaron, will you be so kind and tell us what the bills do? Thank you.
And there are no amendments on these bills, so there's nothing in your amendment packet. But the bills require the Maryland Department of Health to develop a plan to reduce the wait list for 8 specified waiver programs by 50% beginning fiscal 2024. The plan must include measures to recruit and retain providers any changes in reimbursement rates for services under the waiver programs, the expected timeframe for reducing the waitlist for each waiver program by 50%, and the projected cost of the measures to implement the plan. Provisions of the plan relating to the autism waiver must be developed in conjunction with the Maryland State Department of Education. And by January 1st, 2023, MDH must submit the plan to the governor and specify committees of the General Assembly. And then beginning in fiscal 2024, the governor must include in the annual budget bill sufficient funds to carry out the bills.
And just so that the
Bill.
committee knows, the money has been fenced off both by the Senate and by the House, okay?
Both
To
bills.
address this. What did you say, Delegate Hill?
Move both bills, please.
All right. And it's been moved and second by Delegate Hill and Delegate Bagnall. Delegate Kaiser, do you have a question? Yes, what is your
yes,
question?
I do. I do see House Bill 1403. I was hearing a Senate bill number, but I didn't see it on the list. What's the
Senate
number?
Bill 636. So on the agenda, we have House Bill
I'm
1403
sorry, you got a lot of agendas. So the most recent agenda did have both bills.
and Senate
Okay,
Bill
thank you.
636.
Thank you.
And they're actually, thank you, Delegate Kaiser, for your question. They're actually identical and there are no amendments. Okay, and they've been moved by Delegate Hill and Delegate Bagnall. Since there are no amendments, any questions on the bill by the committee? Delegate Kaiser, your hand is up. You have a question?
Nope, I'm good from before. I just
Okay.
have an old
Okay.
agenda.
Want to make sure. Okay, thank you. All those in favor say aye.
Aye.
Any opposition to these bills, will you please raise your hand or let me know now? Seeing none is unanimous for both House Bill 1403 and Senate Bill 636. All right, next we're gonna do House Bill 1412. And everyone has the material. Does anyone not have the material for 1412? Okay, Erin, can you tell us what it does?
There's a reprint to this bill that begins on handwritten page 16 of your packet. The bill as introduced would have established a Parkinson's disease registry. The bill has been amended to just include or establish a Parkinson's disease registry advisory committee in MDH, and they would establish the purpose of the advisory committee would be to assist in the development and implementation of a registry, determine what data would be collected and stored in the registry, including methods to ensure the privacy and confidentiality of data collected and stored, and to advise the department on Parkinson's disease and maintaining a Parkinson's disease registry. The provisions in the original bill that related to the individuals who would be on the advisory committee remain the same. And then the rest of the bill is stricken regarding the specifics of the establishment of the registry. And if you go on to handwritten page 21, there is a report that would be required by the advisory committee to finance an HGO that would before next session, that would include legislative recommendations for the establishment of a registry.
Okay, Heather, do you want to be heard on this before I go to the sponsor?
No, thank you. We appreciate the amendments. Thank you.
Thank you, Heather, for working with us. Delegate Kurt,
Thank you, Madam Chair.
my
I
pleasure.
just want to say that that we're very anxious to get this effort moving, and I know there was some question about the fiscal note, and so we've come back and reworked the bill to address that issue. Just remind everyone that there are 1 million Americans suffering from Parkinson's disease, about 60,000 new cases a year. We don't know what causes it. There is no cure. There is no treatment. And a registry like this is an important step towards working towards effective treatments, identification of causes, and an eventual cure. And thank you for your consideration. And I do have Julia here with me today, who I'd like you to hear from her. Thank you.
Thank you, Delegate. Julia.
Thank you, Madam Chair, and thank you, Delegate Kerr, so much for sponsoring this legislation. And I miss seeing all your faces. Getting this off the ground with the advisory committee first and coming back to work on the IT infrastructure and the rest of the registry is still a great start. And on behalf of the Michael J. Fox Foundation, we are very happy to support the amendments and get this going as part of our mission critical for aggressively funding research and science towards a cure for Parkinson's. And this will feed data after the advisory council is established. They will feed the data into the Department of Health, which will go up to the CDC's National Neurological Conditions Surveillance Program. And this is a model bill that we are running in several states across the country. West Virginia's was just signed last month, and the South Carolina's bill just cleared the Senate last week as well. So this is incredibly important to us as we work towards a cure for Parkinson's and research. And I'm here for any questions and anything that you need from me on behalf of the Michael J. Fox Foundation. Thank you.
Okay, thank you. Bill Pitcher, do you want to be heard?
Thank you very much, Subcommittee and Madam Chair. All I can say is I'll brag a little bit. I'm glad that Julia is my daughter.
She represents you beautifully.
She's much better than me.
Well, any questions from the committee on this bill on 1412? Any concerns that you may have?
Move the amendment.
Okay, may I have a
Second.
second? It's been moved in second. Any questions on the amendments? Seeing none on the bill as amended, may I have a motion, please?
Move the bill as amended.
Second.
We needed lunch today, so we can move quickly.
Keep skipping-
Everybody's sort of
You
delayed.
keep skipping the votes on him.
I can hear you, Delegate Hill.
I'm sorry, I keep missing the votes on the amendments. But
I don't know,
moved it
you
as-
have a delay, Delegate Hill. There's a disconnect today with you.
we just keep missing the votes on amendments.
No, but we did move it, Delegate Hill. I think you have a delay. Okay.
We move it and
Right.
then we don't vote on it. Okay.
On the bill as amended, all those in favor say aye. Any opposed? Delegate Hill, did you hear that?
I hear it. I keep waiting for any opposition on the amendment and we never hear that. Okay, we're good. We're moving.
Okay,
Thank you, Madam
beautiful.
Chair.
All right. The bill passes unanimous. Thank you so much for your patience, okay? And thank you for working with us and all of us in addressing this. Thank you. We have next, we're gonna go to the department bills. So Heather, you are on. I'm going to call them one by one, and then I am going to ask Erin to discuss them. Then I'm going to come to you, okay? So the first one we're going to do is Senate Bill 168. And I have Erin, you can go ahead and get started.
Oh, I'm not muted. Okay, sorry. This is a departmental bill that repeals the exemption from certain Immunet requirements, including providing certain forms and notification and reporting vaccines administered to Immunet for a healthcare provider who administers vaccines in a nursing facility, an assisted living program, a continuing care retirement community, or a medical daycare program. The bill also alters the membership of and term limits for members of the statewide Advisory Commission on Immunizations. No amendment.
Okay, Heather, tell the committee why you need this bill, Heather, plain and simple.
Sure, thank you. So the first part, I think, which is the most important part, it removes the exemption from the nursing homes not having to report data. During COVID, they very clearly showed that they can report this data. It's not a huge burden on them. And really, especially during the pandemic, that data saved probably a lot of lives. So we know how valuable it is. And the nursing homes have shown that they can do it. We did not get any, they didn't express any opposition to that. And then the second thing is it alters the membership. And really that's just needed so that the committee can more easily fill the seats of the open vacant seats. And there were on the Senate side, I think it was the policy partners had offered 2 additional seats that were added into the bill. And so it just simply makes it a little bit easier to fill the vacant seats on the committee.
Are there any questions from the committee members? This is your time right now because Heather's right here with us on this bill. Any concerns? Delegate Shalega.
How does this deal with consent of minors? I see that in the bill a couple times.
The bill doesn't address, and the amendments don't address minors' consent. Where are you seeing that in the bill?
Well, I am reading through it fairly quickly, so,
That none of our amendments addressed anything to do with minor consent.
so it looks like it's adding in the COVID vaccine. Is that what we're doing here, and expanding the commission?
No, we're not adding the COVID vaccine. We are just altering membership. So it removed some members and added some members, and it provided them with term limits for the commission. And then it removed the exemption. Previously, nursing facilities were exempted from reporting to Immunet vaccination data or immunization data. And the amendments remove that exemption
Okay, thank
for
you.
nursing facilities. Sure.
So I hate to do this, and this is why I was trying to expedite things a little, but we want to know what we're voting for and understand it. So we're going to take a break because I have a meeting in the speaker's office. So we will come back. If you could, I'm not sure we're coming back today because we have to be on the floor at 4:30. So most likely they're not tomorrow. But Heather, I want to apologize to you and all the other, every other person that is waiting here, all the advocates that we could not get through, but we will, work on it probably tomorrow. Okay. And thank you, Heather, for working with us.
And the hearing is still in process, so go back and join the team. Thank you.
Okay. Bye-bye, everyone. Thank you.